and welcome to the Bankmed 2022 Benefits and Contributions Virtual Roadshow. I am Michelle Bam, and I will be your host for this webinar. Teddy, our CEO, and Nidhi Naidu, our Operations and Clinical Exec, is with me today. Teddy will take us through information around the COVID-19 pandemic, which is top of mind for most of us. He will also present the Bankmed value proposition as well as the scheme financials. This will be followed by Nidhi, who will announce the contribution increases for 2022, how this compares to previous years, as well as to the industry. Nidhi will provide insights on enhancements of the benefits that can be expected, and I'm sure you will gain much value from today's webinar. I'm proud to present our CEO, Teddy Musumutani, who will do the opening address for us.
Colleagues, welcome. It is the second time that we are connecting in this manner for an event of this nature, at which we disclose to you, our partners, the benefits and contributions for the next year. This is a culmination of a lot of work which is committed to co-creating, nurturing, and demonstrating the value of our partnership. We stand on the shoulders of leaders who came before us, who decided to collaborate in the best interest of the employees of your organization, to have access to good quality healthcare and wellness. I believe we are at a point in history where this collaboration via Bankmed, your medical scheme, is delivering the highest health and wellness returns and promises sustainability into the foreseeable future. However, our response to the pandemic that has already taken so much from us requires change in behavior. This is required individually and collectively, because this time, more than ever, no one is safe until we are all safe. So, as I welcome you this morning, what is top of mind for Bankmed is that your good health has a direct impact on our collective good health. We wish to encourage you to embrace vaccination in pursuit of population immunity. This is about our livelihoods, our families, the success of our organizations, and that of our economy. Our appeal is not an emotional appeal, but it is backed up by science, colleagues. I have been vaccinated. Have you? Creating and nurturing value is what we do, and we have been doing this with you since 1914, believe you me. Obviously, responding directly to COVID-19 had become most relevant and urgent to demonstrate value during the times that we are navigating ourselves through at this point in our journey. It is important, however, for me to give you assurance that the attributes of our core value proposition have remained intact. These include, and this is just a reminder to you colleagues, our partnership in health and wellness, exclusivity and responsiveness to your requirements made possible by you having created your own medical scheme in Bankmed, better value made up of a combination of richer benefits and lower contributions, now tracking at 39.3%, better quality as revealed through health quality assessments, our commitment to best of class member experience, which keeps us on our toes, I must tell you, because of the commitment that we have made in you, embracing technology and innovation as enablers, and financial stability as confirmed by our AA+ global credit rating, which is not surprising because we are governed by bankers for bankers. But let's go back to COVID-19. Bankmed's COVID-19 benefits have been evolving and designed to deliver the best care for our members across all benefit options. Details are certainly available on our website, as we have advised you before. The benefits that we have added since the last time we gave you an update last year at a session of this nature really include the following. Hospital at home COVID-19 benefit. That is one of the new benefits that we have introduced since the last time we engaged in this manner. And obviously, COVID-19 vaccine is one of the benefits that we have included in the package of benefits to respond to COVID-19. We had to remove the COVID-19 isolation hotel benefit with effect from the end of September, beginning of October, because it was not being used at all, unfortunately. And it was no longer making sense to keep it because we are incurring costs for a benefit that is not being utilized. Moving ahead and giving you a sense of some stats on COVID-19 from a Bankmed perspective. As you know, the stats on COVID-19 change every day. It has been more practical to take a snapshot at a certain point in time for the purpose of our presentation today. And that snapshot was taken on the 14th of September, 2021. Now, Bankmed, as is reflected on the screen, has had 28,048 positive cases, with most of these being in Gauteng, as expected, because most of our members operate and work from Gauteng, and this has been followed by the Western Cape and KwaZulu-Natal. Now, what is also important for me to highlight as we talk to this slide is that Bankmed's recovery rate was at 95.1%, as reflected on the slide. This was encouragingly slightly better than the national recovery rate of 93.4% at the time, and better than the average recovery rate of 93.6% for medical schemes that are administered by Discovery Health. Unfortunately, colleagues, we have had fatalities as well at a rate of 2.9% for Bankmed. This was close and only slightly favorable than the national fatality rate of 3%, and also favorable than the average of 3.3% for medical schemes administered by Discovery Health. The number of vaccines administered at the time of taking the snapshot was at 103,884, but let me tell you more on that a bit later. Now, we have had 3,885 members admitted since the onset of the pandemic. With repeat admissions, this became 4,448, and this included about 787 ICU admissions and 456 ventilator admissions. Now, Bankmed's average beneficiary age is around 32, and the average age of members who tested positive was 37 years, with a chronicity at 35%. That simply gives an indication of the extent to which the members who tested positive have chronic conditions. As can be expected, chronicity will be higher for the older members. The one thing that I wish to express, and I want to express this with reference to the breakdown of complete admissions on the bottom right-hand corner on the slide is the fact that the death rate is higher amongst those who get very ill and end up being hospitalized. And this is where the vaccines make the greatest impact. And it is for this reason, colleagues, that from a Bankmed perspective, we are appealing to you again to please get vaccinated. Now, I want to give you a sense of how our benefits have been utilized so far, as reflected on the screen that you are seeing. The utilization of telephonic consultations, virtual consultations, and pulse oximeters have followed the trend of the different waves since the onset of the pandemic. The utilization for the isolation hotel benefit went down to 0, and this is why it no longer makes sense to retain this benefit as indicated earlier on. Now, in as far as the costs that Bankmed has incurred so far since the start of the pandemic, we are currently tracking at just below 696 million. This is spread across out-of-hospital benefits and in-hospital benefits, and 80% of these costs relate to costs incurred for our members when they were in hospital. Now, about 33.16%, and this translates to 71,800 of Bankmed beneficiaries have been vaccinated as at the 14th of September 2021. About 15.88% are fully vaccinated. As indicated earlier on, 103,884 doses have been administered. Now, vaccines by provinces, as reflected on the left-hand side of the screen, have certainly been highest in Gauteng, followed by the Western Cape, and then KwaZulu-Natal. And this, as you will recall, is consistent with the trend of positive members across the different provinces, as reflected earlier on in our presentation. Now, if we look at vaccines by age group, we see that it is highest, for the 60-plus age group, which certainly makes sense because this is a cohort of our members that was allowed to vaccinate first. Now, vaccines administered show that about 80% were Pfizer vaccines, and this is a combination of 48,853 and the 31,951 that you see on your screen on the bottom right-hand side. At this point, I want to talk just briefly about a selection of financial indicators, and there's no intention to present to you a full set of financials. I know that you would have appreciated that because you are bankers, but I'm only making a selection of a few financial indicators for today. And the first financial indicator that I want to talk to relates to what we refer to as non-healthcare expenses. And these are expenses that are associated with running the scheme. For an example, administration and general administration expenses. Now, I want to assure you, colleagues, that we at Bankmed are intentional in our efforts to contain non-healthcare expenses so that most of the members' contributions are used for healthcare expenses. Now, in 2020, our non-healthcare expenses as a percentage of gross contribution income decreased from 4.8%, as you see on the screen, in 2019 to 4.6% in 2020. The industry comparatives available to us relate to 2019, and our non-healthcare expenses at 4.8%, as I have indicated, compared very well to industry average numbers of 8%. We do this without compromising the value that we deliver to our members in as far as what we need to do in partnership with you. Now, our non-healthcare expenses, given that they mainly include the fees paid to our administrator, also demonstrate a good business case for the partnership that we have with our administrator, especially when one considers the value that this partnership generates in the best interest of our members. And this is a factor that always drives what we do in whatever we do from a Bankmed perspective. A second financial indicator that I want to touch on is what is referred to as the solvency ratio. And this is an indicator that I know as bankers you are familiar with. So the solvency ratio is one of the indicators of financial stability. The published industry comparatives available relate to 2019, and Bankmed solvency ratio at 40.5% was higher than the industry average of 35.6%, but lower than the average of 44.3% for restricted medical schemes. So this suggests that Bankmed tried to find the right balance in as far as the extent of our reserves. For an industry as a whole, the claims experience was very low in 2020 due to the deferral of elective hospital procedures in particular. Now, this saw Bankmed solvency ratio shooting up to as high as 50.7%. Now, the scheme is committed to utilizing this financial position in a sustainable way, including carefully allowing for operational losses consistent with the scheme's reserve management strategy, again, in the best interest of our members. We believe that our members are really set to enjoy sustained health and wellness returns from the partnership with Bankmed. However, there is a lot that is unknown about the post-pandemic outlook. Now, in as far as the unknown that I've just alluded to, these unknowns include the cost associated with the so-called long COVID syndrome, that is continuing illness after the recovery from COVID-19 infection, a potential for the catch-up of the elective procedures that I've already alluded to earlier on, the possibility of pent-up demand resulting from members not seeking care during the pandemic and needing more intensive care from the system once the pandemic has subsided. And the other unknown is the potential need for ongoing vaccination drives on an annual basis if the virus becomes part of the life in the so-called new normal. Now, 21% of COVID-19 patients appear to develop long COVID between 30 to 120 days after first testing positive. The long COVID definition, which appears on the screen, and I'm not going to read all of it, but it does make reference to symptoms that continue or develop after acute COVID-19 infection and which cannot be explained by alternative diagnosis. The top symptoms are shown on the screen, and they include headaches, attention disorder, fatigue, breathing difficulties, and others as reflected on the screen. Now, the information at the bottom, of the slide reflects observations from 2 COVID populations, one with severe conditions of the specified diseases on the screen, and the other with mild condition, compared to a population that did not have COVID. Now, across all the diseases or conditions monitored as reflected on the screen, the actual prevalence is higher than expected in the COVID-19 cohort compared to non-COVID cohort. What this suggests is that we should be concerned about the potential future claiming patterns as a result of long COVID. Again, at the risk of sounding like a stark record, it is important for us to get vaccinated so that we decrease the impact of COVID-19 on the quality of our health. In summary, in as far as long COVID is concerned specifically, there is limited evidence on optimal management of this condition. It is certainly a rapidly evolving clinical problem. It is important for public health considerations as the pandemic continues. An approach to management must be developed, and Bankmed will certainly contribute with other stakeholders in the industry to make sure that this does happen. We must accommodate the needs of this group of patients. Further research is clearly needed, and again, Bankmed will do its best to contribute and participate in those initiatives. It is also important for us to also understand this from a local context as well. In conclusion, Bankmed employer group clients and their members are the lifeblood of this leading medical scheme, and this is something we do not take for granted. We have engaged members providing robust input and feedback, and this contributes to continuous improvement on Bankmed's part because of the richness of the feedback and input that we receive from our very engaged members. We enjoy leadership from trustees that come from the institutions that are the pillars of our economy. We have certainly proven to you that we are responsive to COVID-19 and are still committed to deliver on the core value proposition. Bankmed, partly because of our experience and partnerships and collaboration, is readier than most to navigate our way through the challenging times. And the last point that I want to make, and I'm sure you can guess what that point is, let us please get vaccinated. It is not only for our good health, it is for the good health of our colleagues, our families, the population in general, and it is really the right thing to do that is backed up by science. At this point, I would like to invite Michelle back on the stage to come and join me.
Thank you, Teddy. That was an insightful presentation around the financials and the COVID-19. You raised a very important point around vaccinations.
Absolutely. And I mean, what excites me about that point in particular, Michelle, is the fact that I personally am very proud that I got the vaccination. And when I got it, I felt that I was certainly doing the right thing for me personally and for my family. And for the community, including colleagues, at work. And I was quite proud when my daughter also got the vaccination, recently. So it is certainly the right thing to do, Michelle. Yeah. Have you been vaccinated?
Absolutely. I have been vaccinated, being a sportswoman, and I enjoy active lifestyle and attending sporting events. I'm really looking forward to the day we can go back to doing some sporting events and especially the social activity afterwards. I think it is so important. It gives me some form of comfort just knowing that I have been vaccinated. I kind of struggle a bit with my friends. I am a little bit challenged, whereby some of them haven't been vaccinated yet. And I kind of nudge them all the time about getting vaccinated. But there's a lot of anxiety around vaccinations. And I'm just so concerned.
Yeah.
You know, I want to get, I think we all want things to be a little bit like the norm. And I want to participate in sporting events, and I want my friends to join me. So the sooner we can all get vaccinated, the better. So I'm really looking forward to getting back into that environment.
Yeah, Michelle, I must commend you. You are doing the right thing in trying to encourage your colleagues to get vaccinated. Having mentioned earlier that my daughter got vaccinated, there are a few of her friends who are not vaccinated. And I'm also doing my bit to sort of encourage and nudge them, via my daughter. So we need to do this together so that we can ultimately achieve population immunity. So vaccine hesitancy seems to be a problem that is nationwide, and it's a challenge that we are facing, as a nation. And I understand that it may be a result of people not having access to facts, about vaccine. And there's also a lot of information out there which is actually misinformation about vaccine and the vaccine journey. One of the things that we have done from a Bankmed perspective, as you will appreciate, is to consolidate some information that we have placed on our COVID-19 hub, which really debunks misinformation about the vaccine. And it is available for our members in particular to access that information, and anybody else who is interested, so that we can all be empowered with accurate information about, about the vaccine. And so this can certainly assist in our efforts to share with, other people so that they are also empowered with the right information, Michelle.
Thank you, Teddy. I can declare that the Bankmed Hub has helped me tremendously in understanding the information, just not around the pandemic, but also just relieving the anxiety around the vaccination. So we are sorted. But I just want to ask the audience, have you been vaccinated? On that note, we'll continue with the benefits and contribution rationale. And since this is another critical section for our members, we'll focus on the slides while Dr. Naidu presents. Thank you, Dr. Naidu. You can go ahead.
Thank you, Michelle, for that introduction. Good morning, everyone. I would like to extend a warm welcome to all. I am going to take you through the 2022 contribution increases, the benefit enhancements for 2022, and the 2020 health quality assessment results. Before we get to the 2022 increases, I want to outline some trends prior to 2022. What this slide outlines is Bankmed's average contribution increases for the period 2011 to 2021, which is an 11-year period, versus the average contribution increases of the top 3 open schemes, namely Discovery Health Medical Scheme, Momentum Health Medical Scheme, and Bonitas Medical Scheme over the same period. Bankmed increases have been consistently lower than the average increases of these 3 open schemes for this 11-year period, which is very positive and outlines the value received by the Bankmed members. Moving on to some industry average contribution increases for 2022, Discovery Health Medical Scheme will delay the annual contribution increase until April 2022. With the effect from the 1st of May 2022, the contribution increase will be 7.9%. Momentum Health Medical Scheme will also delay the annual contribution increase until August 2022. With effect from the 1st of September 2022, the contribution increase will be 6%. There will be a 4.8% increase on Bonitas, a 3.9% increase on Bankmed, a 6.3% increase on MedShield, a 4.6% increase on Key Health, and a 4% increase on CAMAF. What this slide depicts is a 7-year trend of average contribution increases for Bankmed versus the top 3 open schemes, namely Discovery Health Medical Scheme, Momentum Health Medical Scheme, and Bonitas, and one restricted scheme, namely CAMAF. For the period 2016 to 2020, Bankmed increases show stability versus some volatility in the industry, where in some years there were double-digit increases. 2017 was one such year where there were double-digit increases across all the schemes outlined in this graph, indicating a knee-jerk reaction to what had transpired in the industry in the prior period, namely high claiming patterns and an increase in fraud, waste, and abuse. Bankmed, however, managed to contain the average contribution increase to 7.9% for 2017. With the onset of the pandemic, the focus is to keep contribution increases low due to the state of the economy. For this reason, I am very pleased to share the Bankmed average contribution increase for 2022, which is 3.2%. Outlined on this slide is a breakdown of the increases across the different plans since 2017. For the 2 lower plans, namely the Essential and Basic plans, it is a 1% increase for 2022. For the top 4 plans, namely the Core Saver, Traditional, Comprehensive, and Plus plans, it is an increase of 3.5%, giving us the average of 3.2% for 2022. Annual limits will increase by 4.5%. In summary, we have benefit limits that will increase by 4.5%, which is higher than the contribution increases across all plans. The scheme is preparing to generate operational losses to give back value to members, including some benefit enhancements for 2022. So we are now moving on to plan structure. I'm quite certain that everyone present here today is very familiar with our plans. We have 6 plans with a plan to suit all needs. If we start off with the Essential plan, it is a lean, low-cost plan. Benefits are limited to PMBs only via the GP entry plan network. The Basic plan has a wide range of primary care benefits, including non-PMBs, available via the GP entry plan network. The Core Saver plan is positioned as a hospital plan with a small savings component for day-to-day expenses. The Traditional plan is regarded as our network plan with a wide range of benefits with annual insured sublimits for day-to-day expenses, example pathology and radiology. The Comprehensive plan has a comprehensive range of benefits paid from both insured and savings out of hospital. The Plus plan is referred to as the Rolls-Royce plan. It is the top-of-the-range plan with a savings and an above-threshold benefit referred to as the safety net for when savings are exhausted. All these plans are supported by managed care programs, a rich spectrum of wellness and preventative care benefits, and a wellness-based incentive program, namely Balance, which is available to all members at no additional cost. Active Rewards was launched in August. Member awareness of the enhancements will be created through a marketing plan which will commence soon. This slide shows a high-level overview of the essential and basic plans. The essential plan is positioned as an entry-level plan, suited for low healthcare needs with PMB level of cover only. The basic plan is positioned as a low contribution plan with both in and out of hospital benefits and cover for chronic conditions. There is a rich spectrum of wellness and preventative care benefits on both plans, except for the contraceptive benefit, which is not available to members on the essential plan. Both plans have a restricted GP network, a restricted specialist network, a GP specialist referral process in place, and a restricted hospital network. There are restricted formularies for pathology, radiology, and medication on these plans. Members on these plans have access to managed care programs, but for PMB level of care only. There is no optometry or dental benefit on the essential plan. Optometry benefit is available to members on the basic plan via the Isoliso network, and a basic dentistry benefit is available to members on the basic plan. Moving on to the top 4 plans, the Core Saver is positioned for young, healthy members with relatively low healthcare needs. There is a limited medical savings account for day-to-day expenses. The traditional plan is a network plan with comprehensive medical cover to meet moderate to high healthcare needs. The comprehensive plan is suitable for moderate to high healthcare needs for members who want a savings component, and the Plus plan is designed for moderate to high healthcare needs for members who want a savings component and an above threshold benefit. All 4 plans have a rich spectrum of wellness and preventative care benefits. A medical savings account is available on the Core Saver, Comprehensive, and Plus plans. There is a GP network and specialist network on all 4 plans. The GP specialist referral process applies only to the Core Saver and traditional plans. The hospital network applies to the traditional plan only. That is, members on the Core Saver, Comprehensive, and Plus plans have freedom of choice. Managed care programs are available to members on all 4 plans. However, members on the Core Saver have access to PMB level of care only. Optometry benefit is available on all 4 plans, subject to savings on the Core Saver plan, from the insured benefit on the traditional plan, subject to a combination of savings and insured on the comprehensive plan, and subject to savings on the Plus plan. Basic dentistry is subject to savings on the Core Saver and Plus plans, and from insured on the traditional and comprehensive plans. A dental deductible applies to the top 3 plans and has been in place for a while. The deductible will be $2,040 for 2022. Moving on to the 2022 benefit enhancements, there are certain principles for the annual review, and these include to enhance benefits and innovation. These do come at a cost but are necessary to remain competitive and be the medical scheme of choice for the banking industry. To optimize risk management in order to keep contribution increases as low as possible. To consider a tiered differentiation in benefits between plans, especially for the discretionary benefits, example dental or optometry, where members perceive value and would therefore consider higher premiums justifiable. To lower out-of-pocket payments, to improve member experience, and to ensure alignment of benefits with clinical best practice. With the onset of the pandemic in 2020, this needed to feature prominently and be kept top of mind in the benefit review discussions. So what were the 2022 benefit enhancements informed by? It is a fine balancing act between benefit enhancements, affordability, and scheme sustainability. With the onset of the COVID-19 pandemic, there was rationing of healthcare. What I mean by this is that members did not seek healthcare as they did prior to the pandemic because of the fear of exposure to the virus if they left home. As a result, the benefit review needed to focus on digital and remote healthcare initiatives to ensure that especially the high-risk members continue to receive healthcare to prevent complications and hospitalizations due to not seeking healthcare timeously. In addition, principles of value-based care and contracting to ensure optimal outcomes and better quality care for our members is a focus area. The member-centric philosophy of Bankmed is always top of mind, and so are employer group requests. The first category of benefit enhancements relate to maternity and newborn. The first benefit enhancement for 2022 is a T21 test, which is an expansion of the current prenatal testing benefit. In 2019, the non-invasive prenatal test was added as a benefit subject to clinical entry criteria. The non-invasive prenatal test is a valid screening test for chromosomal abnormalities, namely T13, T18, and T21, which is Down syndrome, the most common chromosomal abnormality. The T21 test is a less invasive alternate to the current non-invasive prenatal test and is able to detect Down syndrome in early pregnancy. Performing screening tests for chromosomal abnormalities are increasingly being considered clinical best practice. The reimbursement of the T21 test will be subject to the application of clinical appropriateness protocols. The next benefit enhancement related to maternity and newborn is an enhancement of the maternity basket of care. The maternity basket of care applies to pregnant female members on the Core Saver, traditional and comprehensive plans. Currently, the following benefits are within the basket: 5 antenatal consultations, 2 2D ultrasounds, a round limit per pregnancy for antenatal and postnatal classes, pathology at 100% of scheme rate, subject to the Baby and Me approved basket of care. The basket will be enhanced with an additional consultation and an additional 2D scan. These additions serve to align the Bankmed benefits with clinical best practice and the guidelines that are published by the South African Society for Obstetrics and Gynecology. The next benefit enhancement is for chronic cover for an additional condition, namely interstitial lung fibrosis. Interstitial lung fibrosis is a severely debilitating condition, and complications can be life-threatening and include heart and lung failure. Currently, members access medication for interstitial lung fibrosis from their acute benefit. As of 1st January 2022, the list of chronic conditions covered on the Comprehensive and Plus plans will be enhanced by providing chronic cover for interstitial lung fibrosis. Clinical entry criteria, clinical protocols, and guidelines will apply. One of the principles applied in the benefit review process is value-based care and contracting. The next benefit enhancement applies these principles. A spinal care program will be implemented in 2022. This is a back pain management program. So what is the rationale for this program? Discovery Health, Bankmed's administrator and managed care partner, has seen an 8% increase in spinal surgeries over the past 4 years. Of those beneficiaries who underwent spinal surgery, 40% received suboptimal conservative care interventions in the year prior to surgery. The hospice-centric approach to the management of back pain is a global problem. The following excerpt from the World Health Organization acknowledges the issues faced. It is estimated that 28% of healthcare for low back pain in Australia and 32% in the United States of America was discordant with clinical guidelines. There is no robust evidence of benefit for spinal fusion surgery compared with non-surgical care for people with low back pain associated with spinal degeneration. However, over the period of 2004 to 2015, elective spinal fusion surgery in the USA increased by 62.3%. What does the program entail? The program is an integrated approach that includes a conservative care program and network together with spinal care centers of excellence. The conservative care program is targeted at members who have had multiple consultations with a diagnosis of back pain, have been admitted for medical treatment for back pain, or who are referred by their neurosurgeon or orthopedic surgeon. Members on the program will receive a course of physiotherapy by physiotherapists trained in the conservative treatment of back pain and will be supervised by a specialist. And the last component is spinal surgery centers of excellence. Centers of excellence have a lower risk adjusted length of stay, a lower risk adjusted cost per event, a lower risk adjusted readmission rate, and better outcomes for the member post surgery. As mentioned earlier, in order to improve access to healthcare and to ensure timeous access to healthcare during the pandemic and post-pandemic, the next benefit enhancement supports this strategy. This enhancement is a virtual house call by network GPs. What is the rationale for this benefit enhancement? To be able to reach out to high-risk or vulnerable patients with chronic conditions in order to ensure that they are optimally managed in the outpatient setting. The COVID-19 pandemic has resulted in a dramatic drop in the number of admissions. This provided an opportunity to shift care to the out-of-hospital setting while protecting and enhancing the quality of care. This dynamic is particularly relevant in the South African private sector, where care is biased towards costly in-hospital care. This initiative entails proactively reaching out to at-risk members who might be inappropriately rationing care due to the pandemic, with the aim of preventing disease exacerbations and serious admissions. Who is eligible for the GP house call benefit? All members registered for the chronic illness benefit, that is the chronic disease list of conditions, and those members registered on the HIV program will have access to the benefit. The Bankmed GP network and the Premier Plus network GPs will deliver this service. High-risk members are defined as members with a predicted high risk of admission and where an intervention is reasonably expected to prevent the admission will have access to this benefit. Predictive analytics will be utilized to identify these members. What is the role of the GP? A list of high-risk members will be loaded against the GP's profile on Health ID. The GP will proactively reach out to high-risk patients and set up time for a virtual house call. The GP will be provided with a script to follow to ensure optimal outcomes from the consultation. That brings us to the end of the benefit enhancements for 2022. We are now moving on to the health quality assessment section of the presentation. Earlier today, Teddy outlined Bankmed's value proposition. We see quality as another component of that value proposition. What is health quality assessment? It is a benchmarking exercise in the funding industry which highlights key quality issues in the South African medical scheme industry. It drives improvement in the delivery of evidence-based medicine. 18 schemes from 7 different administrators participated in the 2020 Health Quality Assessment. This comprised of 91 benefit options and represented 7.02 million beneficiaries, which is 78.68% of the medical scheme population, and is indeed a very representative sample. 4 categories are evaluated, namely prevention and screening, hospitalization, maternity and newborn, chronic disease management. What is the definition of quality? There are many definitions of quality. However, the Agency for Healthcare Research and Quality defines quality as the degree to which healthcare services for individuals and populations increase the likelihood of desired health outcomes and are consistent with current professional knowledge. If we look at the first category of primary care, which includes screening, Bankmed performed better than the industry in all areas. By industry, I mean the 17 other medical schemes that participated in the 2020 Health Quality Assessment. However, if we look at the last column, which are international benchmarks, Bankmed and the local funding industry are lagging behind. The international benchmarks represented here are for those metrics where the local and international definitions are aligned. For most of the metrics, there is little alignment, and the reason for the not available in the benchmark column. The next category is chronic disease management for diabetes. Once again, Bankmed did better than the industry in all areas, but once again lagging behind international benchmarks. In the category chronic disease management for ischemic heart disease and asthma, Bankmed is ahead of the local funding industry but is lagging behind international benchmarks. With respect to chronic disease management for cardiac failure and chronic obstructive pulmonary disease, Bankmed fared better than the local industry but lagging slightly behind international benchmarks. There is one area where the local funding industry did better than Bankmed, and this is with multiple admissions for depression, which is highlighted in red on the slide. What the health quality assessment does is that it highlights areas for focused interventions where Bankmed is lagging behind the industry. In 2021, we implemented the mental health program for depression together with the mental health relapse prevention program for depression. One of the objectives of this program is to provide optimal support post-discharge to prevent a readmission. This trend will be monitored to assess if the desired outcomes are being achieved from the program implemented. In the hospitalization category, Bankmed did better than the local funding industry with respect to cardiac procedures and spinal surgery. In the last category, measured namely maternity and newborn, once again Bankmed did better than the industry in all areas. This slide is a scatter graph and shows Bankmed's overall performance against the industry in 2020. Bankmed being the red dot and the green dots represent the 17 other schemes who participated in the health quality assessment in 2020. The horizontal axis is the risk-adjusted average contribution per beneficiary. The contributions have been risk-adjusted for age, gender, and chronic disease. The vertical axis is the overall score. Overall, Bankmed was number 1 in the industry in 2020 as depicted by the red dot, and this number one performance is for the 6th consecutive year. We are very pleased with this outcome. However, due to the pandemic, for some of the reasons outlined before, example, members not seeking healthcare as they did pre-pandemic, the entire industry, including Bankmed's performance, dropped when compared to the 2019 performance. What this implies is that there is no room for complacency and that all efforts need to be made to ensure that we get back to and exceed the pre-pandemic performance. This last slide and scatter graph outlines what I have just indicated about Bankmed's 2020 performance, which dropped when compared to Bankmed's 2019 performance. This scatter graph shows a 3-year view of Bankmed's performance represented by the 3 red dots. In 2019, Bankmed performed better than 2018, this trend being in the right direction. However, Bankmed's performance dropped in 2020 for the reasons I've just outlined. The green dots represent the average score over the 3-year period of the 17 other schemes. Prior to 2020, as Bankmed improved its performance, so did the industry. Bankmed lost ground in 2020 and so did the industry. To be able to catch up and exceed the 2019 performance and stay ahead of the industry, Bankmed will need to ensure that we remain energetic and focused to get there. This slide outlines all the contact details that Bankmed members can utilize. That brings me to the end of the presentation. Thank you for your attendance. I sincerely hope that you enjoyed the presentation today. Take care and stay safe. Back to you, Michelle.
Thank you, Dr. Naidu, for that incredible presentation on what Bankmed is doing for its members. Contribution increases has never been lower, and the benefits are testament to Bankmed's constant need to keep our members covered, healthy, and well. Bankmed has made the promise to be your partner in health and wellness, and our most recent showcase is the launch of the Enhanced Balanced Wellness Rewards program. Active Rewards features exclusive to our members at no additional cost. Being a sportswoman, I am always looking for ways to stay fit and healthy, but to earn rewards for doing so is an added bonus. Active Rewards encourages and rewards you for getting healthier. You can access Active Rewards in your Bankmed app. Start earning great rewards for getting active today. I decided to redeem my miles for a delicious smoothie. What will you redeem your miles for? While you're thinking, cheers to change in health and wellness. We are now moving to the formal questions and answer section. This structure will take the form of an interactive online chat platform where your questions will be answered by our executive team. While you're typing in your questions, what has change been like for you? For me, it's been quite a ride. What keeps me focused is my daily routine. A good night's rest, nutritional meals, keeping my exercise regime, and preparing for my workday helps to keep me in my zone and at optimal performance. I see there's questions on the screen. We'll be popping over to the chat box and share the Q&A screen with you now. Thank you everyone for your attendance and for your active participation in another incredible year-end event. We trust that Bankmed has shown that we are committed to being your partner in health and wellness, especially in time of change. From the Bankmed team, until next time, keep safe, keep healthy, and goodbye.